palliative care, it's about taking care of patients who have a life-threatening or life-limiting illness. So what we do is to focus on improving their quality of life by having a holistic approach to their illness. That means we will not only focus on their physical problems, which is the symptoms that will bring them to hospital, but we also look at the social issues, psychological and spiritual issues, so that overall we are able to help that patient to cope with their illness and the family as well.
Palliative care is not at the end of life. It is not for the dying. It is not hospice care. It is for all patients with life-limiting illness. Most of our patients who come to this clinic, they come because of pain and other distressing symptoms. Palliative care is not only when they have started having pain or they have started getting disease out of control. For example, when the patients have cancer, we need to start from the diagnosis so that we can start the journey together. It is a long journey which has a lot of difficulties on the way. So we need to work with them from the diagnosis. When they are going through treatment, we are there with them. When they are going through other issues, we are there with them so that we can support them together with their family members.
So palliative care is for any patient who has a life-limiting or a life-threatening illness, and it starts from the time of diagnosis. So the examples of these conditions include cancer, advanced cancers. It includes neurological conditions. Some children are born with congenital malformations that need a lot of care. So those are the kind of patients that we take care of, elderly patients as well. And the patients get different aspects of the care depending on the stage of their disease. So at the time of diagnosis, they need more psychosocial support. Then as their disease gets worse, they need more of the physical symptom support or now the active management.
Our work is what I may call multidisciplinary. It can be two-way, coming from them to us or coming from us to them. There are those patients who have the chronic diseases who are to live with the diseases. So which means in most cases they are mentally disturbed. They are also having a lot of questions why they may be living, whether God has left them. So in most cases when you are dealing with the palliative care, we listen to their stories so that we can hear what are their needs, so that you can help him realize that even if you are in this situation, your life is more worthy, and also the forward you may hope for better than what you are in now. Is that giving hope that each day is a different day from the day you are in, and that may make the person to even feel more happy than feeling depressed and also turning to himself or herself.
Illnesses for children are categorized. So we have some acute illnesses, then we do have illnesses that are likely to get better with treatment, but sometimes they progress. For example, childhood cancers. Some of the children with leukemia can be treated and they get better, but sometimes they don't get better. Then we have progressive neurological conditions and other congenital anomalies that are likely to result in this child having a lot of suffering and a lot of care that is needed throughout their illness. Now, when we go to adults we look at illness in also three ways. There's acute illnesses that are treated, and sometimes if it is a fatal illness, someone just dies, it's a very sudden death like heart attacks. Then we have progressive conditions like cancer and neurological problems. Then we have some illnesses that are now called terminal, that from the time we diagnose them, it's very unlikely that that patient is going to recover. So those are the patients that need palliative care, and they should be referred as soon as a diagnosis is made, because palliative care aims to work with the curative care to give the patient and the family the best experience. It is not easy to have an illness, it is not easy to take care of someone who is sick, but we help them to understand from the time of diagnosis what other care do they need in between, and we work with the other doctors to ensure that the patients are still getting their treatment and still getting quality of life.
The advice I can give to family members who are taking care of one of their own with life-limiting illness is that being a carer is draining. It can also overwhelm them, and they also need to take care of themselves as much as they are taking care of one of their own. So they need to debrief themselves. They need to come to us even for counseling and support. They also need to, if there are many in the family, you don't take one role you alone to take care of if it's a parent, we advise them to have shifts. If I'm taking care of my dad today, another one can take over, another one can take over the next day, like that. But basically it is self-care. They need to take care of themselves because they will go into burnout.
Members of the family, in fact, they are also suffering just like the palliative person, because it depends whether this person is living with an disease and is able to do his things or to do some few things, but also there are those who everything has to be done. So mostly mentally is what we deal with them mostly, and also we listen to them to know what are their concerns also.
In our training, there's a whole topic about communication and breaking bad news, because it is not very easy. Actually, many healthcare providers shy away from discussing bad diagnosis with patients and families because of the tough questions that come following you telling someone that they have an illness that is incurable. So the approach is we try to simplify it, that we start by having a good environment to have this discussion. So we look at the setup. Do we have a quiet room where we can interact well with the patients and we minimize distractions? Don't have your phone there. Let there not be people walking in and out of this room. Then we ask the patient whether they have anyone with them, their family or just themselves, and we give them a warning shot that, I have some bad news that I'm going to talk to you about, and we try to find out how much do they know about their illness or their journey. So from the time you started being sick, what has been happening, such questions, so that we gauge how much information the patient or the family has. Then now we take them through the steps of, okay, these are the symptoms you've been having, these are the tests that have been done, these are the results that have been found, and we give them time to react. So we validate the reaction. Some people get angry, some people get sad, some people get depressed. So we give them time. If it is too much for them, then we have to organize another session for them to absorb this news, and then now we have questions. If they are able to take it, then now we move on to trying to clarify. Have they understood what we are saying? What is the treatment plan? What options are there? And what wishes does the patient and the family have, so that we now help them to make decisions about their care?
We advocate everyone who has a life-limiting illness to get palliative care. We have palliative care services here in Kenyatta National Hospital and across the country, so they should not suffer when they are going through an illness. Our doors are open, they just walk in, you don't need a consultation at times, you just walk in because our signpost says pain and palliative care, and especially when they have pain. Pain is the worst symptom, because that is what makes the patient come to the hospital. Just walk in and we are going to address your pain.
So the costing for services in KNH is similar to other specialized services in the hospital. So our outpatient clinic patients will pay 1,150 for consultation. Then again in the ward, the costing is the same, just like other services. Yes.